When would I use TEE versus TTE in a rescue setting? I think the major deciding factor here is how much time you think the patient has. If the patient is already undergoing ACLS and chest compressions, well, that's a different situation that doesn't have as much time as a patient with moderate hypotension where you want to get a little bit more information. So I ask myself, do I have between 5 and 15 minutes where that much delay would not significantly hurt the patient? The reason being is because if these probes are kept on different machines, then you have to call for the next machine. Also, if you spend several minutes trying to get views with your TTE probe, if you don't end up getting adequate views and get your clinical question answered, then you end up having to do the TEE exam anyway. Then I think through what the likelihood is that I would get inadequate views or be unable to perform with TTE. Chest access is limited with sternotomy, with drapes, CPR. If you need to look at certain structures of the heart that are posterior structures, that's when I would want to preferentially choose TEE first. And just as a brief summary point, if a patient is ever undergoing ACLS, I will always prefer TEE if able. You have superior views, you can get them quicker, you can use that as an ongoing monitor, and you won't interrupt CPR to place the probe and to get your images. And I will do this as long as the patient does not have any absolute contraindication.